The Afghan humanitarian situation is still concerning. More than 750,000 people who have been displaced due to conflicts and natural disasters live in informal settlements. This results in difficulties in providing efficient assistance. Cost minimization rarely takes a central role in humanitarian logistics, and other performance measures such as equity of distribution are seen as more important. However, statistical data can help to determine patterns and predict the types of aid most valuable to people in need. Therefore, the overall goal of this project is to support evidence-based planning of humanitarian action in Afghanistan in order to make aid provision more efficient. This will be done by answering the following question. What is the most valuable data that can be collected by humanitarian organizations on the community level to predict the priority need of displaced households? This slide shows the outcome variable of interest, which is unbalanced in the data. This research tries to get an insight in what features play a key role in reporting these priority needs that humanitarian organizations could collect on a district level rather than through expensive and time-consuming household surveys. This project is structured as follows. First, data was cleaned and prepared, and after that, decision trees are used for class prediction and to get an insight in attribute relevance. Then, a lasso regression model was run to compare it to the decision tree, followed by spatial analysis by district. REACH initiative assessed the informal settlement population in Afghanistan by conducting a survey among 7,000 households in August 2017. This dataset originally had about 200 variables on, for example, demographics, displacement, and assistance-related questions. We deleted, combined, and added new variables to the dataset. For example, lots of variables had too many missing values, making their predictive power low, just as the variables which only had one value. These got deleted from the dataset. Here you see some examples of variables that got combined to one variable in order to reduce the number of features in the total dataset. In addition, some variables got added to the dataset related to conflict and disasters. Now that the data is ready to work with, a decision tree is built with the aim to provide a clear, interpretable representation of a model. The graph can be used to show humanitarian aid providers what data to collect, but the downside is that the tree only predicts 3 priority needs: employment, food, and shelter.
To make a model that predicts more priority needs, a lasso regression with cross-validation was run on the training set. The regression was multinomial with 5 upsampled outcomes: priority need of shelter, water, food, education, or employment. The lasso resulted in a model with 12 variables and around 40 total factor levels. The model was run on the test set and the RSC curves are shown. The accuracy, determined from the confusion matrix shown, was 58%. The model predicted shelter and employment relatively accurately, but did not predict education or water accurately due to their low occurrence in the test data. Given the importance of district in the decision tree model, the lasso regression was evaluated for predictive power by district. Of the 51 districts in the data, the lasso regression predicted the majority need of 30 districts correctly, which are 80% of the households in the training dataset. The accuracy for the incorrectly predicted districts was only 27%. As the map shows, there is no clear spatial distribution of incorrectly predicted districts. However, there are some clear differences between the two groups. Incorrectly predicted districts are, for example, more likely to be close to a market and less likely to be affected by natural disasters. Therefore, a new lasso regression was run on data just from these districts with accuracy of 50%. The improved accuracy of this model shows promise for further exploration of fitting models by district characteristics. The 12 variables selected by the lasso regression are shown on this slide. Humanitarian organizations should focus their data collection efforts on these variables as they held the most predictive power in determining a household's priority needs. Additionally, we recommend that additional data is collected on health and education to allow for the better prediction of related needs, and that more data be collected on incorrectly predicted districts in order to determine their distinguishing characteristics and train a more effective model to improve predictive power for these areas. Finally, we recommend that humanitarian organizations in Afghanistan adopt a predictive model like those shown in this presentation. The decision tree and lasso regression models can significantly improve the efficiency and efficacy of humanitarian aid giving, particularly in remote or isolated communities where it is difficult to collect data but aid is urgently needed. Model implementation is expected to reduce costs while increasing the number of communities in remote areas who receive aid that aligns with their priority needs. This was our project. Thank you for listening.